This is actually one of the most common questions we get and should be a part of all breast augmentation consultations. The similarities and the differences should be discussed and clearly understandable to you. A silicone implant and a saline implant are actually very similar in that the shell, the part that touches your body, is the same in both instances. The difference is what's inside. A saline implant has a slightly thicker shell, it's made of silicone, and is filled with saline, which is essentially salt water. A silicone implant is filled with a polymerized silicone gel. Different implants have different amounts of polymerization. This simply means how stiff or thick is the gel. Matching the right implant to you and your desires is a critical component of any breast augmentation consultation. With regard to the differences between silicone and saline, after the contents, the most important difference is what happens when that implant fails. All implants have the potential to fail at some time in the distant future. When a saline implant leaks, as all implants eventually do, the water, which is inside, is simply absorbed by your body. This can be quite a disastrous kind of feeling for a patient. Ultimately, that implant is simply replaced by opening the incision pocket and removing the implant. However, the timing can feel quite urgent. This is the most important difference between a silicone and a saline implant. When a silicone implant leaks, it's essentially silent. You, as the patient, would not know about it without monitoring the implants with an MRI. This is recommended by the FDA to be performed 3 years after placement and every 2 years after that. An implant that is leaking, a silicone implant, can be monitored for some time and changed out at a time that's convenient for you. This makes a silicone implant far more convenient than a saline implant. There are additionally several differences with regard to texturing, palpability, and complication rates. With regard to saline implants, they tend to feel stiffer, have more rippling, and have a higher rate of scar tissue forming around them over time. For many of these reasons, I strongly recommend silicone implants for my patients. They have a time-tested safety profile, and many of my patients enjoy years and years and years of happy surgical results. Are you ready for surgery? At Care Plastic Surgery, the next step is a phone call. We look forward to hearing from you. Call us at Care.